Hello everyone, my name's Lyndon Smith and I'm currently a fourth year student at the University of New England doing rural science, and today I'll be presenting some information from my honours project which is in relation to cause of death in some of the MLP sheep. As previously stated, there was no autopsy done on the F1 generation of the flock. This information is important for other areas of research to do with the flock, and contrary to some belief, an autopsy is required to accurately assign cause of death. In order to remedy this, in the 2019 flock, in addition to doing field observations of the cause of death, an autopsy was also taken of the lambs that died, allowing for a comparison to be made and an accuracy to be determined of the field observations, which could later be applied to the 2017-2018 flocks. In short, the object of this project was to see how accurate the Chiswick lambing teams could be at identifying the cause of death in the field. So in the 2017-18 lambings, birth data was collected in addition to educated field observation and assignment of cause of death. This was broadly categorised into dystocia, starvation exposure, predation, and a list of a few other less significant causes of death. In the 2019 flock, the birth records as well as the field observations of cause of death were taken. In addition, an autopsy was also carried out on all the lambs, allowing for the comparison to be made between the field observations and the autopsy results. This is a basic example of a data collection sheet for each animal. It is broken down into 4 sections. The first contains basic information on the animal, such as the tag number, date of birth and date of death. The second section contains information on external indicators of cause of death, such as whether the lamb has walked, the presence of meconium, which indicates difficulty at birth, and swelling around the head and legs, which indicate dystocia. These indicators are also used as part of the field identification of cause of death. The third section contains basic internal indicators, such as internal bleeding or fluid buildup in the chest or abdominal cavity. The fourth section contains indicators that are specific to organs, such as if there's air in the lungs, milk in the stomach, and the metabolism of fat from around the kidneys and heart. This section also contains hemorrhaging scores for the brain and spinal cord, higher levels of which indicate dystocia. From this data collection sheet are then combined with the flowchart created by Gordon in order to assign a cause of death. These causes of death fall into 10 categories as shown by Holtz. Opposed to the field identifications, in the autopsy, dystocia is divided into 3 subcategories, which are distinguished by whether the lamb has breathed, whether it has walked, and the presence of swelling around the head. Starvation, which is distinguished by the metabolism of fat around the kidneys and heart and the lack of any hemorrhaging on the brain or spinal cord. Primary predation, which is usually hard to distinguish from secondary predation, as most of the indicators have been removed by the predation. Primary exposure is also separated from starvation, which is indicated by the lack of fat metabolism around the kidneys and heart, as well as the death usually occurring during periods of bad weather. There are also several other more minor causes of death. These causes of death can be divided into 2 categories. The first being those that are easily identifiable from external indicators. These include things like dystocia 1, death in utero, misadventure, and external congenital defects, as these all have clear and obvious indicators of the cause of death, such as discoloration of the skin, swollen head, obvious skeletal deformities. The second category are those that can only be identified by an autopsy. These usually appear externally as having extremely similar identifiers, and that's what makes them hard to discern from each other. These are also extremely important to differentiate from each other, which is why the autopsy is important, as some of the major causes of death are present in this category, such as dystocia 2 and 3 and starvation. Here we have the results of the experiment with the assignment of death from the autopsy listed along the top and the assignment of death from field identification on the left-hand side. The diagonal purple numbers indicate the number of lambs that were correctly identified in the field, with the areas circled in red indicating areas where there was a high degree of error. The lambings teams did not attempt to differentiate between the three types of dystocia, and they did not try to separate starvation from exposure. This resulted in the data being classified simply as dystocia, which accounted for 40% of the lamb mortality, and starvation exposure, which accounted for 36% of the lamb mortality. These results were extremely similar to those seen in 2017-2018 lambings, as well as previous research done on the subject. However, only 74% of dystocia and 71% of starvation exposure were correctly identified in the field. This indicates that although the proportion of the mob that died from each cause were similar, the individual identification of cause of death was not as accurate. The major causes of death were dystocia and starvation, which accounted for 76% of all mortality. Of these, 75% were accurately identified in the field. Overall, the field diagnosis in 2019 was 67%. This isn't great, but the small sample size allowed for the minor causes of death to have a greater influence on the results. Apart from this, most of the error in assignment of death occurred between dystocia 2, 3 and starvation. Based on the field diagnosis versus the autopsy results in 2019 and the known high level of dystocia 1 rate in 2017-2018, which can be inferred from the higher number of assisted births in those years, we can conclude that the field observations in 2017-2018 were 75% accurate. I would like to thank Gordon for his advice on this topic, as well as thanking the lambing teams for their help in collecting the data.